Welcome, everyone. It's 9 o'clock. We want to start on time. Welcome to the 2022 Individual Placement Support Leadership Conference. My name is Theresa Razzano. I'm the Division Director for Alameda County Behavioral Healthcare Vocational Services. We are excited to share our work with you. We've been doing individual placement support for the last decade, and we've seen some just amazing things from our clients that we set a high expectation for them to get jobs, and they exceed our expectations while using IPS. People are working now and competitively in a variety of occupations and industries. We have, with the only hurdle is for them to express an interest and motivation to work. So we are thrilled to be able to share with you in the next 2 days everything that we know, and we have some amazing colleagues from throughout the state that are using IPS, as well as some guests that are from outside of the state that are joining us as well. Let me introduce my co-host, Chris.
Good morning, everybody. Chris Llorente here. I'm an IPS trainer for Alameda County Behavioral Health. It's fantastic to see everybody in the chat. We're looking forward to a great couple days of all things IPS. Not a sprint, it's going to be a marathon. So stick with us. We got a ton of sessions. Join one, join some, join all. We'd love to have you.
So what I'd like to just say before I introduce our first distinguished guest is that we have been using individual placement support for about a decade. It was 2012 when we launched. And prior to that, Alameda County used a very traditional model of rehabilitation, which is considered a stepwise approach. What I can say is that the excitement of this model that we want to share with you in the next 2 days and hopefully inspire you to launch your own IPS program is based on what we have seen from our clients. We assume that our clients can work. It's a strength-based model. And when people have expressed an interest and motivation to work, we engage them as soon as we can. So we sit down, we do a master app and application, and we get them there in front of an employer within 30 days, which is much different than other types of models. And the other part of what I like about this program or this model is that it treats our clients as we would want to be treated. So if any of us wanted to get help in getting a job and went down and sat next to somebody and said, hey, can you help me? We would want them to embrace that wish immediately and get started. And that's exactly how this model addresses, that interest. So what I can tell you is that if we did nothing with our clients at all, that about 11% of our mental health clients would go out and find their own jobs. With traditional stepwise approaches to rehab, with our population, about 22% will go and find jobs. With individual placement and support, the numbers of job placement jumps to about 47 to 50%. So I can tell you that just in the last 2 months that Alameda County's program has been about 47 to 50% job placement rate. And I have colleagues in Solano County that shared with me recently that they had a 65% placement rate. So it is dramatic and it's exciting. So without further ado, let me jump in here and introduce our first speaker. Dr. Tribble has over 25 years of practice in the behavioral healthcare field and is an experienced and dynamic administrator. Over her career, she has held a number of leadership roles in California and on the East Coast. She currently serves as the Director of Behavioral Healthcare Services for the County of Alameda and formerly held the position of Chief Administrative Officer of Behavioral Health Services for a large East Bay public health system. She has served in executive leadership in organizations providing crisis and acute behavioral health care services, consultation to individuals and families, schools and organizations, forensic services, integrated primary care, and previously managed mental health services in the city of Berkeley and Albany. Dr. Tribble is a published researcher. She holds a Bachelor's of Science degree in psychology from Howard University, a master's degree in social services, a master's degree in clinical psychology, and a doctorate of psychology degree in clinical psychology. She is also a licensed clinical social worker in the state of California. It is my honor and excitement to introduce to you Dr. Karyn Tribble, Agency Director for Alameda County Behavioral Health.
Thank you so much, Theresa. I really appreciate the esteemed welcome. Part of me was excited to meet this Dr. Tribble. She seems fantastic, so I'm humbled, and thank you all. I am so happy to be here, and I'm very, very honored, actually, feeling in terms of to be in a position to welcome you and to just kick off this really exciting IPS collaborative conference. One of the things I was thinking about is what can one say when one kicks something off such important? I know far more than what I'm going to say. There are so many esteemed panelists and guests and from across California, the states actually, and nationwide and beyond. Really appreciate there is just so much of an interest and an investment in the population and in this work. It speaks for itself in terms of the outcomes. But as I began to think about it, I think one of the things that brings everything together is clearly the evidence-based principles that we know and we espouse and we look toward in terms of individual placement and support. And as I thought about it, the zero inclusion, making sure that it's closely integrated with mental health treatment, making sure that competitive employment is the goal, the benefits and the incentives are provided to individuals and our clients, and really following up with continuous support, development of relationships with employers, and really making sure that the consumer preferences are honored. All of those tenets make it critically important and are huge contributory factors to its success in IPS. So that's a given. But as I began to think about really setting the stage, which I think is my charge for this brief introduction, is to not only welcome the entirety community, but really echo that I am honored and that there is so much more than just the work that we do. It's how we approach it. So as part of kicking off, I hope that you are open and listening and in a place of honoring already, which I'm sure that you are. But I think I'll take us down, if you can indulge, just down a small journey as we prepare. And some of the things that I wanted to just touch on very briefly before we begin and before our guest speaker is beginning is just to talk about briefly the intersection between employment, belonging, and agency. And when I say agency, I don't mean the facade or the organization that we all are part of, whatever the work that we do, whether it's part of our family or anything else. The agency that I'd like to talk about, to get you to think about as we prepare for this conference, is the agency of self-determination, of worth, of value, of all the things that make up an ability for a person to feel self-efficacy and being a privileged member of the community. So that's really what I'd like to talk about. Again, the intersection between employment, belonging, and agency. And I promise there's no test, but I just hope you indulge as we prepare ourselves. So as we think about how we support our community, whether you're from a place of lived experience, family member, professional, organization, advocate, whatever that is, what I also like to remind myself, at least in the work that has taken me through many years of work in the field, is that really this IPS work hits closer to home. And maybe it's something that you can take away from the words that I'm going to speak, is that it not only impacts the lives within mental health, but it does across the field of mental health, including ourselves. So if you won't judge me again, I want to take a brief walk down memory lane. And as was already mentioned, I have a few years of experience. And so I can say, I'll use an example of my time in the past. Now, this example is unique because it is not necessarily of a client, but it's really a professional who may not see themselves as a client, but they clearly had lived experience. And this is more 20 some years ago. So we'll name her Mary, just for the sake of her own life journey. And Mary was a clinician who worked on behalf of families and clients and young people in the community, different state, different circumstances, so I feel comfortable talking about it. And one of the things that Mary did was she committed herself to supporting individuals so they can, again, individualize their own life trajectory. again, that intersection with agency in her perspective was important. What's unique and why I would like to hopefully prepare people for this journey is to remember that as we support our clients, our consumers, our families, the journey first starts from within. And for many of us, if we take for granted that we have our own need for belonging and agency and that sense of value and purpose, if we forget that and we forget that we have all taken this journey, I think we lose such a sight and a privilege of what it really is to do IPS work. So Mary had an experience, and I happen to be, this is as an example, again, kind of a real life example, but the participants and changes and the circumstances I'll modify a bit. But I happen to be her supervisor, and I was a director 25 some odd years ago in a different place, different lifetime. And Mary actually was a fantastic clinician, insightful, helpful. She did a lot of her work in the community, would drive her car wherever she needed to go. And her own supervisees and direct service staff really felt privileged to work with her because she worked alongside them. As we know, technology changes, and this was kind of when internet was, it was of course alive in emails, but really people didn't use it as they do now, where we can't really stay disconnected from it without feeling like we've lost all sense of purpose and direction. Mary had some challenges as the workforce began to change and we began to rely more heavily on internet and communications in that way. And I could see it in her work. The quality of her work didn't change at all. And I remember as productivity standards began to come up and people looked at how, quote, productive she was, again, the outcomes were fantastic. We began to see some differences. And so for me, investing in her and her free agency as a person was important. So I took her aside and say, hey, you know, I know we're changing. I'm trying to catch up. I'd love to delete every email that I get. I'm late. I'm responding. I haven't figured, there was no texting, you know, in that sense at all. We were lucky to have a flip phone that could send 911 or a pager in terms of really having access to it. But she disclosed something to me. And what she said in her own personal journey, it was an experience that she was wrestling with, is that she had seizure disorders. And in her treatment, she was so proud to be in remission and have that condition well controlled for many years, and was so proud to be able to drive. So she actually felt privileged to be able to do the work that she was doing. One of the side effects that she disclosed to me was remembering certain details and not the clinical details, not the things that matter, not the relationships, not the outcomes, not creating the treatment plans, nothing that had anything to do with her work. But when she began to read and get bombarded by, again, people really excited about email and would email random chain letters and all that, it was somewhat difficult for her to attend to it. And so I held that, because as we started to look at productivity, some of the measurements that we as leaders, and I use the word royal we, had developed, was more of an agency approach, was to measure how quickly one could respond, how quickly one could do things. And what was important to her was to not disclose her medical condition. She had many traumas and many traumatic experience in her previous life with disclosing her own personal journey. And what she felt is that by telling people what she had experienced, what she and herself believed that she had overcome, she would set herself up to be treated differently. Now, that was difficult for me, because what I understood was that, you know, you could get an accommodation, you know, we could get people, those who look at productivity, and I think leaders and employees and staff are on this call know what that means. But she said, no, I don't want accommodation. I want to do my work, and I want to do it well. And I know that I do it well. I can figure this out. And as a leader, I had to think about her desire for that word, as I said, agency, and her desire to not be stigmatized, and her desire for belonging was so important to her, and that at that time she didn't believe that we were ready to support her as just a regular part of our community, as a regular employee, as a quote regular contributor, as a regular clinician. She was really, really, really guarded and concerned. So fast forward many, many months, I did hold that private disclosure and felt that that was her testimony to make and her experience to disclose. Unfortunately, so many things began to befall her that really marks against her in terms of productivity. So at some point, Mary did have to disclose. And the sad part, as a professional supporting individuals who really was an advocate to avoid stigma, the stigma that she feared did occur. Our leaders began to think of how they could rearrange her job. They thought about how they could make it difficult for her, in her eyes, to do the outpatient, the community work. She prized her driver's license. She had earned it back after having some really difficult challenges many, many, many years before. So in essence, the agency that even a professional committed to this work had so longed for was taken away by acknowledging a condition that by no fault of her own that she was experiencing. And I say that to say that if you think of what it feels like as a person who is now privileged to have an opportunity to work through IPS, who within 30 days can be in front of a job and interviewing and feeling that sense of it, whether they are a client, whether they are in a place for whatever reason of having to personally disclose, there is a sense of loss of agency to all of us when we take what is personal to our experience and enable others to be in the space with us. So in this case, for Mary, it was difficult. And for her, ultimately, she opted to kind of make a different career choice, one that didn't involve community-based work. And it was difficult for her. And again, I share it not as a negative story, but how it really hit home that the sense of belonging and the work that we do through IPS means so much. And yet it comes from a place of enabling individuals to have to tell their story essentially by being connected, but also have to hope and have faith in the system that we're all designed to create, that won't experience, that experience of having their agency impacted can be avoided. Another example, for Mary, I'll say the name was John. And now that I think about it, there's no biblical reference. This isn't the Mary and John, just names that I'm pulling out of a hat. But again, I hope that it hits home that it doesn't really matter whether you happen to be involved in IPS, but the sense of agency is a thread throughout our experience. And so we, or whomever you are, whatever your role, I hope that you remember as we advocate for these placements and we advocate for these great outcomes, that we remember and think really critically and insightfully about every decision that we make and every partnership that we take and every disclosure that we enable our clients and our communities to make. There is a sense of agency potentially lost unless we hold them up in a place of privilege and honoring that which they choose to disclose and that which they can disclose and their ability to make some life choices. So John, the other example that I wanted to talk about, this is from a slightly different perspective, and this hopefully will land in a place of, again, these are quote professionals that are committed to this work, but it happens to all of us. So again, my point by sharing this is to think of how close it feels, if it hits closer to home, to have that empathy and understanding and to really be proud of the outcomes that despite all of that, people are able to do this really, really great thing and better and improve their lives. So John, this gentleman, again, real life experience, was involved in a traumatic, actually, car accident. And he too was a clinician, and he happened to have advanced degrees, again, alphabet soup, I guess, very much as one might look at my background based on the introduction to myself. But John was and had many, many years, 30, 40 years in this field of behavioral health, and was committed to working with children and families around some very complex issues, traumatic issues. And after John physically recovered from the car accident, there was some traumatic brain injury that he suffered. Not to the degree of impairment in terms of walking or his ability for speech, but there was a noticeable difference in his ability to hold on to some of the prior details that he had been so fluent in before. And I speak of fluency, this gentleman happened to have mastered multiple languages. He just was so committed and able to reach their clients and his families in so many ways. So I mentioned him after that event. Again, this intersection of employment, belonging, and an agency. For John, he actually was not aware of the differences. And I guess that it's a blessing and a curse to be around people in the behavioral health field, because though we deny it, we can't help but analyze you walk into a door, how are you feeling? And that could mean so many different things. But for John, he was a light, he was bright. He lit up a room when he came into the office, and he continued to do that. And there were changes that we noticed in his ability to make some key decisions, and not sure why, but my job and role was tasked to connect with him and to see what can be done as far as a peer. And the good thing for John is that though he was not aware, he began to see the need for support. He began to see some of the outcomes that he had previously achieved with his clients, and the excitement that he can engender had somewhat diminished. And so he was able, through respect, through dignity and a dignified approach, to craft a work-life balance that could enable him to do his work. And again, he still was able to maintain that sense of belonging and still see our clients and our family members, and do so differently, but do so dignified and in a way that he felt outstandingly proud about. No one knew. It was clearly a professional change and decision that he got to make, and it was a personal experience that he had. But what we left with, and what I left with, was that his connection and his ability to be successful really did depend on his ability to feel a sense of belonging and purpose, and his ability to continue to do the work that he was called for. And as you fast forward and you look to what our clients experience and the bravery that it takes for them to work in placement. Again, as you prepare to learn from so many experts, far more with expertise than I have or even can convey, I hope you think about what your community, what your agency, what your role, what your advocacy, whatever it is, whether you are overseeing programs, you're working directly with clients, how can you help an individual leave an experience better than they started with? How can they have this employment and maintain it, not only for the fantastic outcomes that we know and those important principles that IPS espouses, and it works, but also as a human being, that existential need for us to feel purposeful. We all know that COVID has shaken the ground out from under us, so it's a privilege to be in an environment where, nevertheless, we are still seeing people make such difference. I encourage us to think about, though, with the bottom having been dropped, and now the life hopefully is slowly being pieced together despite and beyond COVID, that you think about that existential part, the intangible part of those principles that really intersect between feeling a sense of purpose, feeling a sense of connection, and feeling a sense of pride. And again, I know so many of us are committed to this work just because of the reasons that I mentioned. So one can say that whether you're thinking about how you can see and connect with and make successful a person with conditions who are working in a placement, or who are struggling to maintain their medications, or are struggling to balance their trajectory of recovery, and you're thrilled, and we reinforce them for all of the concrete outcomes that they do. What I encourage you also is to look at that individual, because it affects us all, whether we're behind the scenes, quote unquote, making these things happen, or whether receiving it. One can say that an agency, a coordinator, an advocate, a clinician, a researcher, we understand what IPS is and why it's an evidence-based practice and that it works. And because these are fundamental elements that are the basis for helping individuals achieve employment and gain purpose. And so the reminder again that I'm sure and certain that I am speaking to people who are receptive to that, but just as you begin to look at the individual sections and the learnings that you'll be welcoming, I'm sure with eager interest, that you think of the human intangible metric by which to evaluate existential success. And that, in my humble opinion, is that intersection between employment, belonging, and self-agency. So on behalf of Alameda County Behavioral Healthcare Services and so many, again, other esteemed leaders and team members, I'm so pleased to welcome you and hope that those stories not only took you down a lane, hopefully not too tangential, but just put you in a humble place of being receptive to all that you can learn. And hopefully, again, that unspoken truth that every individual, regardless of the experience, seeks to achieve. So with that, I am so excited to yield the floor back to the moderator because I know that our keynote speaker will be bringing us so much more information and excitement and energy and learning. So I thank you. Thank you for taking the time to indulge my walk down memory lane, and hopefully it's meant something to the journey that you have the next 2 days. Thanks again.
Thank you so much, Dr. Tribble. That was fantastic. I'm always inspired when I hear you talk. Thank you. I also want to say that not only does inspiration hit when we see our mental health clients get employment, but there's a secondary advantage here to our mental health systems and our providers. That when we started this practice, we had a lot of our providers that were pretty skeptical about whether people with psychiatric barriers and illnesses could actually work competitively. And I can tell you that today that there's an expectation from our providers, whether they're case managers, therapists, even our psychiatrists, will refer and advocate for their clients to be referred to get jobs and to go to school. And there's much more of a lift, if you will, on a lot of our mental health teams because they see successes. They see the clients that they've been working with so long actually move down that path of recovery, and they get a shot in the arm around their own work, that there is a light at the end of the tunnel, and that their people are doing better, and they're integrating and having their own lives, and succeeding. So just one more reason, to embrace this model. All right, we have our next speaker here in the queue, and let me introduce our keynote to you. Joe Xavier is the director of the Department of Rehabilitation. He has over 36 years of experience in business and public administration, as well as many years participating in advocacy and community organizations. As an immigrant, a blind consumer, a beneficiary of Department of Rehab services, Joe has the experience and understands the challenges and opportunities available to individuals with disabilities and the services required to maximize an individual's full potential. Joe believes in the talent and potential of individuals with disabilities and investing in the future through creativity, ingenuity, and innovation, ensuring decisions and actions are informed by interested individuals and groups, and pursuing excellence through continuous improvement and preserving the public's trust through compassionate and responsible provision of services. It's my privilege to introduce to you Joe Xavier, Agency Director for the California Department of Rehabilitation.
Wonderful. Well, thank you for those very kind words. Whew, that's a long introduction. I felt old just listening to all that, but glad to be here with everyone. Good morning to everyone, wherever you may be in the state today. And so glad that you've made the opportunity to come to this forum and have an opportunity to share and learn with each other. And thank you to the folks, Theresa and team, that have created this place and this space where we can have the conversations, where we can continue to evolve our own awareness and understanding. I would be remiss if I didn't acknowledge Veterans Day and honor those veterans who have served, who may be with us, and those that are in our families as well. And then, of course, believe it or not, we are in November. Where did that come from? Thanksgiving is around the corner. I just wanted to take a moment and wish all of you a safe and joyous and happy, relaxful Thanksgiving. So I want to speak to you a little bit this morning, and I'm going to come at this from a number of different angles, all focused on the people that we are here to serve, individuals with behavioral health disabilities. And I think it's important to start with, where are we today, right? And today we are in a period, an unprecedented period of transformative change, right? Today we're in a place where disability is included in conversation so much more than ever before, right? But it also means we're in a place where the conversations must normalize disability in the everyday engagement and the very fabric of society that we're working in. We're in a place where we're going to expect and experience change on a scale unlike we've seen before, right? Individuals with disabilities in the workforce, right? A California for all must include all exception none. Everyone can go to work, should go to work. And it is incumbent upon us to figure out how to help that individual make that happen. The state as an employer continues to hold an important role in leadership and responsibility in hiring individuals with disabilities into our workforce, but not just the state. Every single one of us who is on this call, who is a hiring manager or influences hiring, has that responsibility. Employment, our last speaker mentioned, and I will echo, is a determinant of health. People who are employed enjoy better access to healthcare, have better healthcare, have better opportunities, right? And employment is that path out of poverty. This isn't theoretical for me. This is not academic. This is lived. I enjoy this because of the employment opportunities that I have had. And today, we have a very important conversation taking place around diversity and equity and inclusion. Very important. And equally important to include in that conversation, disability. A whole person demands that we consider the intersectionality. Someone who is Asian, who is an immigrant, who's a member of the LGBT community, who is blind, has a number of different elements that we need to account for in the work that we do. So it's important that we continue to give voice to the intersectionality when we talk about equity and when we talk about inclusion. So who are we talking about when we talk about people with disabilities? Well, in addition to the 61 million in the country that have a disability, let's talk about the individual who is going to be born today and who is relegated to living a life of little or no expectations that they will and can and should go to work. Let's talk about the individual who's going home tonight and regretfully tomorrow morning is a quadriplegic, traumatic brain injury survivor, okay? And let's talk about the individual who's going to be injured in service, whether it's the country, to state, or to community, acquires that disability, or the individual, because of illness, because of cancer and other ailments, might have an eye removed, might have a limb amputated, might suffer an acquired traumatic brain injury. And let's talk about the individuals who are living in the shadows of isolation because of their hidden disabilities and their inability to bring their full selves to everything they're doing. If we're fortunate, if every one of us who do not have a disability are fortunate, we're going to age. And as we age, we're going to experience those limitations of aging. Now, in some conversations, those are called limitations of aging. In my conversation, it's the same thing as having a disability. So wherever you sit today, you will be touched by disability in some fashion. The change has taken place in our world of work with the pandemic. Today, we have access to work at home, work from anywhere in ways that we had never thought of before. It has been majorly accelerated. We have shifted to a hybrid workforce where you work at home sometimes, you're working in the office sometimes. We are shifting our workplace to accommodate that hybrid workforce. So the idea that you might come to the office and have your own workspace, it's more likely that now you're going to come to the office and have that shared workspace, shared with others who are not in the office at the same time that you may be. And we know that this shift to remote work is creating employment opportunities that were not otherwise available to individuals with disabilities before. And as we do all this, it's very important that we guard against the social and the emotional isolation that comes from being remote, from being less connected with peers, with colleagues. We also need to expect that the evolution of hybrid work, of remote work, is going to be rapid in the coming 3, 5, 7 years. What we experience today when it comes to remote work is vastly different than what it was 3 years ago. And in my humble opinion, 3 years from now, 5 and 7 years from now, it will be equally different. We will learn, we will evolve, we will address some things that we have thought of, and we're going to identify other things we have not yet thought of. Systems change and advocacy, or something that we have been working on for decades, right? We've long advocated for inclusion, for integration of everyone into society, into our workplace. And today, more than ever, systems are providing for that inclusion, for that integration, right? In community, living, and employment is the responsibility of every system, the medical system, the social services system, the healthcare system, the education system, faith-based, everyone plays a role in ensuring that individuals have that opportunity for employment and to live in their community of choice with purpose and dignity. Essentially, that integration that we have been asking for, that inclusion that we have been asking for, is when systems are truly designing themselves for universal access, where everyone has the opportunity for that full participation. Now, as we've done this for decades, we are now faced with a question that I see coming up more and more. Did we mean it, or are we just kidding? Did we mean it when we said, you must provide those supports in that system so I can get a job? You must provide those supports in that system so I have the opportunity to live in my community of choice with purpose and dignity. How do we bring the expertise that each of us has developed in our respective areas to those systems that are today embracing that universal design, that inclusion, that integration in ways they had not before? And how does each of those systems bring that expertise to what we're doing? How do we start to work across all systems for the benefit of a person-centered, whole person approach? And it is not a carve-out for specialization. It is a carve-in so that everybody with a behavioral health disability has that meaningful opportunity to engage in all of these systems. So one such example, think about the reform that Medi-Cal has done through CalAIM, where community supports for individuals to be able to live in their community are being delivered through medical systems. Now, I applaud the heck out of that. And those systems need our expertise to bring to their table so they know how to deliver those supports. And some of those are very relevant to individuals with behavioral health disabilities. The question is, what are the tables that we should be at that we're not? So we can learn what your system needs from us that we are better at providing and can support. And who should be at the tables that we're at that is not, so they can help inform the work that we are doing. These days, bold, stretch, impact goals is what's driving true systems change. And they're becoming that major systems drive at federal, state, local government levels. They're becoming that major systems driver in corporate, right? And we can anticipate an increased use of bold, stretch, impact goals. Incremental goals are important. They make improvements, but incremental goals do not transform systems. The bold, stretch, impact goals requires that we forget what we know to learn something new. It requires the capacity not likely available today. It requires service delivery models that we have not yet fully embraced. It requires delivery of systems of services by systems that we don't traditionally typically think of. And it requires that we embrace that dynamic tension of getting it right and getting it done. We've got to move to doing things in months, not in years. It means not business as usual. And that has to be something that all of us, regardless of where we're working or what system we're in, are embracing more and more and more. It largely means that we have to transcend systems that we're not typically or traditionally engaged with. What are some of the transformative initiatives that I can point to as I have this conversation? Well, think about the work that is being done in getting individuals ready for employment. Here at the Department of Rehabilitation, we're taking on an initiative of doubling student services, serving 30,000 to serving 60,000 annually. Think about the work that we're doing here, which is piloting caseloads by sectors rather than by disabilities or zip codes, and engaging businesses in the hiring of individuals with disabilities. So we are going upstream in the hiring managers, education, and training, and we're embedding information on hiring individuals with disabilities, supporting individuals with disabilities in the workplace. We're working to change that paradigm in the business community that hiring people with disabilities is not a social good. It's an imperative market practice. 60 million individuals, family, friends, and allies is one of the largest blocks of citizens. That means representation is market access, and market access is what we need for profitability. The state continues to evolve as a model employer. We have ways to go, but we'll continue to lead in that space as well. When we focus on prevention and intervention, think about the work that has been done to end some minimum wage here in California. Think about the work that has been done to create an alternative diploma instead of a certificate that leads individuals into employment where a certificate does not. We're going upstream and working with the behavioral health system, the treatment system. They embed employment as part of the treatment and the value of employment for behavioral health, okay? The value of employment of individuals who have behavioral health disabilities. My thoughts are not coming from a place of clinician, not coming even from a place of lived experience. My thoughts come from those individuals who have behavioral health disabilities, who have shared with me personally and directly the importance of employment on their lives. Okay? The employment giving them the opportunity to stay well and to not regress to the point where they need the intensive treatments. The importance of recognizing them as a whole person and their ability to bring their better selves into the workplace. IPS has long been recognized as a model that leads in this space of getting individuals with behavioral health into the workforce. And today, we need to continue to give voice to how to address disclosure in the workplace. Because without that disclosure, how does the ability to bring their best selves to the job? How does the individual get the supports that they need? Individuals will not disclose in the workplace because they hear me say it's okay to do so, it's safe to do so, right? They're going to watch and observe what I do and how I handle the conversation in the workplace. And they're going to disclose because they feel welcome, they feel supported, and they believe they will be embraced if they disclose that they have a behavioral health disability. Again, the importance of us continuing to normalize the conversation to eliminate the stigma that comes from behavioral health, to eliminate the stigma in the workplace so the individuals do feel welcome and belong and can disclose. So I'm going to share a quick story. A number of weeks ago, we hired an individual that came to us. And when I met this individual, they shared that they had been in a place where they had participated in a disability advisory committee. And so naturally, I asked them what drew them to join that committee, and they gave me a very correct answer. It's a passion of mine. I've long advocated in this arena. I said, okay. And so I challenged that individual to have a conversation with their boss and in turn other folks and ask a simple question. Why does Department of Rehabilitation exist? Why are we here? Well, a few weeks go by and I had an occasion to meet with that individual again. And so we had some business that we needed to transact. And so we did that. And at the end of the conversation, the person said, can I share something else with you? Well, of course. A couple of weeks ago, when you asked me why I had joined that disability advisory committee, I wasn't totally truthful with you. I said, okay. I said, well, I too have a hidden disability, but I didn't feel comfortable telling you. And I don't know why I'm telling you now. And I said to the individual, well, obviously you can't speak for you. My guess is you may have heard that we were open and welcoming and embracing, but maybe you didn't believe it until you see it. And maybe now that you've seen it, you're comfortable saying so. Back to my earlier point, it's not just what we say, folks. It's what we do. It's the workplace that we create that will support that individual being their best self in the workplace. The Department of Rehabilitation provides the services that helps anybody get a job, keep a job, or advance in their employment. And those services include anything that individual needs to get, keep, or advance in that job. Right? We deliver those services locally through 85 offices across the state of California. And that includes individuals that are going into the workplace because they're pursuing higher education. That includes individuals that are going to the workplace through career technical education, otherwise known as apprenticeships. That includes individuals that go directly into the workplace and progress through the opportunities provided therein. We also provide services to students, as I mentioned earlier, which ensures that they are becoming more prepared and better able to be in the workforce when they become of working age. And we provide services to businesses so they will hire, advance, and keep individuals in their workplace. I want to touch a little bit on the governor's recent executive order to address equity. All of the departments have been tasked with identifying within their programs and services disparities in the populations that they are serving. And so we here have been taking a close look at our behavioral health population that we have been serving. And we have identified, probably not a surprise to anyone, a disparity in the population that we're serving in our Black and brown population. They are coming to us and getting services on par, but they're not leaving with the same opportunity as other individuals. So what this means is that we are targeting not only increasing the population of behavioral health leaving with greater opportunity for employment, but that everyone is leaving earning $7,000 per quarter, which is not what had been the case. Black and brown were earning $5,900 and $6,200, when Caucasian were leaving earning $6,500. So as we embark on addressing the inequities in our programs and services, you're going to see more and more of this. And you as community business partners provide an essential role in moving employment needle for individuals with disabilities. You're often closest to those individuals that are being served. And you're essential in that business alignment. You're essential in that systems alignment. You're essential in those conversations at the local level that need to transcend the systems to have the impact that we're having. And as we move to address the inequities in our programs and services, you will be essential in making that also come through. So just a couple of final thoughts. One, question I want to ask all of you. Why are you here today? Why did you make the time to come and join and be present in today's conversation? And who should be at this conversation today that is not here today? How will your actions meaningfully impact the employment of individuals with behavioral health disabilities tomorrow? Theresa, I'll stop my comments there and turn it back over to you.
Well, Joe, on behalf of everyone here today, thank you so much for taking the time to speak with us on the very, very important topic of employment and how critical meaningful vocational activity is for health and wellness. Your comments on how the lives of those in need are positively affected when we as vocational specialists dedicate our time is really inspirational. You brought up so many, key points, normalizing the conversation about disabilities in the workplace, highlighting social determinants of health, incorporating diversity, equity, inclusion, and just the paradigm shift that I think is on the horizon as far as how we provide services. It's not, it's not going to be business as usual. That we really have to adapt and change with the times. So we thank you, Joe, for what you and also the other 1,800 DOR workers across the state of California do for those in our community. Once again, on behalf of Alameda County Behavioral Health and the IPS Collaborative, thank you so much.